flu shot, because now is the time of year when you should be going to get one. And as per usual, there are always the people that will speak them and say, what's the point in getting a flu shot? It doesn't work. Does it work? Does it not work? What do you think, Victor?
Yeah, Tracy, it definitely does work. So I want to first touch on that topic about it not working. So each spring, top researchers and scientists look into Southeast Asia and try to determine which of the virus is most likely to come to North America during our winter. So they take the top 3 or 4 strains and they put into a vaccine, and it's guesswork. I mean, not every single year they can guess the right strains, but it's our best chance. And this is against a virus that affects hundreds of thousands of people, causes over 12,000 hospitalizations per year, 3,500 deaths in Canada. So it's really important to become protected. And this year, it's estimated that it'll provide about 30 to 50% protection. So if there is even a 1 in 2 chance of reducing hospitalization or feeling miserable for 1 or 2 weeks, why not get the flu vaccine?
Yeah, why wouldn't you,
Exactly,
right? I mean, the odds are pretty good that at least you're doing something. So you, I love the honesty here, because last year's flu shot actually missed the mark, and we all know that.
That's right.
This year there is a bit of a chance of it maybe not being the exact strain that we need, but still, even with that said, there's a 30 to 50% chance of protection.
Right, exactly.
Right? Okay, so I got my flu shot a little bit earlier, and you know what? I feel better getting it. I've been getting it since I was pregnant with my second child, and I haven't had a bad strain of the flu ever since. So
amazing.
Why wouldn't you take that chance? Let's talk a little bit about what you can do to bump up your immunity just to protect yourself from getting the flu outside of the shot.
Right, so the main thing is to stay healthy this winter.
Yeah.
So get a lot of rest, drink a lot of fluids, exercise a lot, and this keeps your immune system very active to fight off any flu in case you get it.
Right.
But the second thing is to also protect yourself. I mean, the flu comes in little droplets in the air, and they're floating everywhere, particularly when people cough or sneeze, or even when people are talking, just like you and myself.
Right.
So wash your hands often. When we touch a lot of things throughout the day, public transit, at work. So you don't want to be infecting yourself with it. And hands away from the face. We have a tendency to touch our nose, our mouths, our eyes. So you really want to avoid that.
Okay.
But by far, try to get the flu shot. And I urge everyone to get the flu shot this year. And as a helpful tip for parents, this year, for the first time in Ontario, parents can request for children 17 years and younger the intranasal, so nose spray, flu vaccination.
Oh, so no needle.
Yeah, no needle.
You just get it. You get it inhaled. You inhale it.
That's right. So it's great for kids who are afraid of getting poked, getting shots. And it's just 1 spray into each nostril. And they sniff it, and they're vaccinated. So it keeps the kids healthy all winter.
You have to be under 17, so just stop it right now. You still got to get a needle. But honestly, it's not that big a deal getting a needle either. It's really quick in the shoulder and back out again. I want to talk a little bit about the things everyone should have in their medicine cabinet to keep them ready for this time of year.
Yeah, so in the unfortunate instance, if you do have a cold or worst case scenario, a flu, there are a few things to keep on hand. So you want to always keep some acetaminophen or some ibuprofen, so that's Tylenol or Advil, just in case you have a fever, any pain, muscle aches, or chills. You want to keep also some decongestants. This includes maybe some pills or some nasal sprays to help with any stuffy nose you may have. You want to have some cough medication for any of the annoying coughs. Lozenges, because you're not always going to be home all day. You want to be outside and out and about. And lastly, you also want to have a humidifier.
Right,
when
to
you're
get
sleeping.
that moisture in the air, right?
Exactly.
It really does help limit the coughing and all of that stuff and gets that moisture moving around, which is great. Thank you so much for that. Great tips. Everyone in today's audience will be taking home a $25 gift card from Shoppers Drug Mart. So get some stuff for your medicine cabinet. All right, let's go to break. More coming up. Stay with us. Good tips.
More on Home Day. I'm going to show you a master bedroom and dressing room that's a little different architecturally here at the Princess Margaret Lottery Show.
Tune in to City.